Today I want to talk to you about how artificial intelligence is transforming breast imaging and how Smit and Partners is embracing this transformation to help our patients' outcome. Breast cancer remains one of the commonest cancers in women worldwide, and early detection is absolutely crucial. Unfortunately, interpreting mammograms is not always easy. Dense breast tissue, subtle lesions, and doctor variability in reporting makes this incredibly difficult, and this is where artificial intelligence really comes to the forefront. Lunit has developed state-of-the-art deep learning algorithms that assist radiologists by analyzing mammograms with impressive accuracy. Lunit can detect lesions, calcifications, and asymmetries that might otherwise go unnoticed. What's especially powerful is how we use it to be our second reader. It offers decision support that improves our diagnostic accuracy and consistency across all levels. Lunit doesn't just help us in our detection of subtle lesions. It improves our workflow, reduces our false positives, and helps prioritize our high-risk cases, which is critical when we are under pressure. The future of breast imaging and using artificial intelligence is not about replacing radiologists, it's about empowering them. Lunit's work is a perfect example of how artificial intelligence can support clinical judgment and improve patient outcomes. Smit and Partners is committed to staying at the forefront of developing technology, including artificial intelligence, to enhance our patients' experience.